Hello, hey everyone, welcome to Sleepy Radiology classes. And I promise it will be easy for you. Hey viewers, welcome back to Sleepy Classes. And today we are with a new topic, but I'll not say the topic name right now. Let's move on to the image. So this is what? This is a CT scan image, right? And next you are going to get an X-ray image. So basic differences between the images formation in CT and X-ray is CT is giving you a 2D or 3D image, so you can see the structures in three-dimensional way as well as in the form of cross section, whereas this is an X-ray image where you can see the image in the form of 2D and only just anterior to posterior. So CT scan allows you to see the pathology in three-dimensional view in the form of slice, and X-ray is going to give you in the form of 2D, and there will be a superimposition. So let's move on to our topic for the day. So straightway we are moving to the equipment for CT scan. So now you can see here, this is the first CT scan machine, and who is the inventor for CT scan? It is none but Sir Godfrey Newbold Hounsfield with Sir Edward Allan Cormack. So both were known as the pioneer of our CT scan invention, and CT scan came into the field in 1972. So why it was a late in the invention field? Because the Sir Godfrey doesn't have much amount to bring the machine in the market. So there was a company known as Fit Beatles. It's a musical company who had sponsored for this invention, and that is why our first CT scan machine is known as EMI scan. So in this machine you can see there is a gantry apparatus, and inside you can see a hollow transparent block, and that is known as the water bath. As first generation CT scan was taking a long time, so this specialty was there in this scanner, and this hold the patient and prevents the immobilization. So that was the specialty of our first generation CT scan. And this is our today's modern CT scan machine, and this is not only CT scan, this is the fusion machine known as CT PET machine. Wow, we are now in the modern era. So looking forward, we are moving to the main equipment for the day. Is first you have to know this is a CT scan gantry. Okay, the circular one like a donut shape, and this gantry is around 70 centimeter. Okay, next thing is you can see here that is a bisection point, and this is known as the isocenter. Next we will move on the parts which we see from the external view of the gantry, and so on. So number one is the isocenter. So you, for every scan you have to place the patient in isocenter midpoint. Okay, next thing is number two is the area where there is the microphone. So from there, once you give any instructions, from there a patient can hear as well as he can say also during the exam. Number three is the area from where the x-ray comes out, and that is in the form of point source. Number four is the display panel where you can see the display of the items. So number five is our scanner indicator where you can see when x-rays are on, it is going to indicate you. Number six is the emergency stop button. If there is any kind of emergency in the department, सिर्फ जाके दबा देना emergency press button, then and then the machine will stop and it will be in its position. Number seven is the gantry control panel. So here I'll say you about the operations of gantry control panel. Number eight is my external reference line beam. So it is going to give you the information about the coronal plane section. And even number two, there you can see one more point is there, that is known as the sagittal reference scan line. Okay, next is number six, same, your both in the both side you can get the gantry control panel as well as our emergency button. Number 10 is my ECG display monitor, and additionally you can have, like I'll show you in the later, there is image acquisition display monitor is also there, which is useful for us now in doing biopsy cases, any kind of post processings you can see there, and it is very helpful for the person who is inside the room. Next you have options for pressure injector, which allows us to inject contrast automatically, and that's all the part of our external view of the CT scan machine. And number 9, none but not, that is the patient couch. So I hope now it is very clear to you about the topic for the day, and the topic for the day is CT control panel indicators. And today we are going to discuss about what are the various points we have and what is their function and how we have to know at what time we have to operate them. So let's move on. So this is what is our CT gantry control panel, and it is present where in both sides. So let's see now what each point means. Okay, so that is in the center point. You can see this is the first point. So if you're pressing here and if you're putting any of the four keys, your table movement will be very fast compared to regular movement. So now from circular, from here you can see that is the tabletop button. Once you press this tabletop, your table starts to move upward. Next you have table down button. So once you press it, the table comes down. Next you have the table cradle out and cradle in. So in means it is moving inside the gantry. Out, if you press, it moves outside the gantry. Okay, तो ये जो मिडल का बटन है वो है फर्स्ट, मतलब इसको दबाने से या किसी भी चार बटन दबाओगे तो वो बहुत जल्दी काम करना शुरू कर देगा. ठीक है, उसके बाद ये ऊपर वाला है टेबल टॉप बटन, जिससे आप प्रेस करते हुए क्या हो जाएगा, आपका मशीन टेबल जो है वो ऊपर उठ जाएगा, और टेबल डाउन प्रेस करने से मशीन नीचे की तरफ डाउन होने की लगेगा. इन और आउट से क्या होता है, मशीन इन से अंदर जाता है और आउट से बाहर आ जाता है. So from our midpoint we'll just move upward. Now you can see that is one practice button. Don't press it unless it necessary. Even it is not necessary also. Next is tilt option. So tilt is mainly to tilt how much, even if you press it you can see how much your machine has been tilted on the display above. Next is internal landmark. So this is for landmarks line internal side. That means your 2 point X indicator will indicate you. Next is external landmark, that is the y-axis one. Next is positioning lamp. So once you press it you can get this light on for the centering. Straight coming down you can see this is a gantry tilt option. So the gantry can be tilt at least plus minus 30 degree. So you can, by pressing this one you can say that the gantry will be tilt backward, this is plus 30 degree. By tilting this one your gantry will be moving forward tilt, and that is minus 30 degree. Okay, this is the indicator for gantry lamp. And if you press the stop E, that is E stop for scanning. So that all are the functions of our gantry key. I hope it is now very much clear to you for your operation. And moving at the topmost you can see there is one first button is for your pause, means once you press it your scan will be on progress. And second one is for exposure, once you press it you will get the expose. And finally you can see this is how a table blink, and the screens displays you what is the table movement, what's the ISO center. This is very much helpful, this all plus minus degrees for biopsy purpose, so that you can have an exact location. So you can see now here the top, this is a scanner line. Okay, so this is y and x direction and makes you the isocenter. And also the inner first line of reference is known as first reference line, and second one is known as second reference line. So these two lines are very much helpful whether you want to do in direction or out direction. So if you are doing position in second reference line, that is your out direction, and if you are doing a positioning in first reference line, that is your in direction. So that is how you see here, you have seen how they have done the positioning. So the x direction, x line, external laser light will be direct perpendicular to the mid certal plane, and y scanner line should be perpendicular to your mid coronal plane. So this thing you have to keep in mind while you are doing the positioning of the patient. So that was all about the gantry operation, and I hope it is very much easy for you right now. So I hope you can see some digits are displayed in the gantry panel, and that is what I am saying you is this is very much helpful for our biopsy purpose. You can measure how much direction the table is in, and what is the height of the table is there. So if sometime laser lights are not working also, this will help you also regarding your positioning. So that's really useful for us. Next is, you can see here, this is how a table tilts, and the gantry is tilted right now here, and it is taking plus minus 30 degree. You can tilt your gantry. So this is our CT scan table, and above the table if you can see there are supporting parts, and this is mainly the headrest. So when you are doing any position for skull, so you can place the patient in the headrest, and it will prevent immobilization also. And we have something like knee rest, we have foot rest, which we mainly useful for abdomen, next thorax studies, and in thorax patient direction will be towards the feet, so that is why feet rest is useful. So this is what you can see was the image acquisition panel inside the room, which is very much helpful during our biopsy CT fluoroscopic procedures also. In this acquisition system, an operator can stay inside the scanner room, and he can see from there itself what is happening inside the patient body. He can do adjustment also. There is jockey stick function also you have available in this type of acquisition system. So next, straightway we move to the display system of the CT scan equipment, and that is there is two types of computer. One is host computer and the one is the display computer. So mainly जो host computer होता है उसका main purpose होता है आप वहाँ पर पेशेंट डाटा एंट्री करते हो, स्कैनिंग प्रोटोकॉल सेट करते हो, तो इट इज़ मेनली द मेन कंप्यूटर जिससे हम हमारा स्कैन ऑपरेट किया जाता है. नेक्स्ट इज द डिस्प्ले मॉनिटर. सो देयर यू कैन डू द फ्लिमिंग्स एंड ऑल. सो दिस इज द कीबोर्ड ऑप्शन. देयर इज ऑप्शन फॉर टिल्ट, मूव टू स्कैन, स्टॉप, स्टार्ट स्कैन, pause, x-ray on. Even you can do by pressing F1 to F5, you can do flimming options. Enter, you can select the enter buttons. So many things are there. There is option to talk volume. Once you press that one, you can give instructions like breathe in, breathe out. If you have to say anything that don't move the scan. So all these things are very much helpful with the help of key button. I will forward you a link below. Just follow the link in that, and it will be very much easy for you which button is working in which function, because it's not possible for me every time to say na here. So please follow the link below. So next is, once you how we do the setup for patient is click the patient registration, and you can get these things. You have to enter the exam number, next accession number, that is the patient ID number, hospital ID, patient name, birth date, age, gender, weight, physician name, radiologist name, operator. And you from here there is two options, adult and infant. If you are doing for babies, select the infant one. If you are doing for adult, you can select, and you can see what are the areas like skull for brain, thorax. So all these things as per on you can select and press on, and you can move to the main control panel. So you can see the top, this is a gantry direction. You can select whether it is head in, out, head first, foot first. You can select what are the protocols you need, so like scan protocol, timing, recon, if you need flaming protocol. So all these things are available in our host computer. So next is, see, this is the inner view of CT scan machine. It has the yellow ones are the detector and the black ones are the x-ray tubes. Okay, so this is what is inside the gantry. Mainly it consists of two collimators also, pre and post patient collimator is there. So this is the inner view of your CT scan machine. You can see which, and this thing also you can record it from inside. Keep in mind that the detectors may be 180-degree direction also, or it may be full divided into two types. So that is below one is the detector and above one is the x-ray tubes. It has high tension cables inside too. And now we are in the another session, and I hope you have, it is very easy now for you to operate your CT scan machine. And this is the newly launched mobile CT scanner. It is used mainly in OTs for having three-dimensional views during the surgeries, and it's very helpful nowadays. So last but not the least, thank you so much for your kind attention, and I hope it is very useful for every freshers, staffs, trainees to know what function of the gantry operation, as well as the link below will guide you recording your recon, selection, flimming and all. So that was all about your CT scan equipment gantry a panel, and I hope you have liked it. Thank you so much, and please do subscribe more and like